Bismillah ar-Rahman ar-Rahim. Jazakallah khair everyone for joining the third training of the series. My name is Ala Khandakshi. I'm the Deputy Secretary General for the Muslim Council of Wales, but I am here today working with Muslim Council of Britain, contributing to the COVID response group. First of all, I'd like to bring in Dr. Wajid with some Quran recitation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم أمن هو قانت آناء الليل ساجدا وقائما يحذر الآخرة ويرجو رحمة ربه قل هل يستوي الذين يعلمون والذين لا يعلمون إنما يتذكر أولو الألباب. Allah subhanahu wa ta'ala says in the Quran, say, are those who know equal to those who do not know? Only they will remember who are the people of understanding. This ayah in Quran is very pertinent to what we're discussing today, because today what we're going to do, inshallah, is try to educate or bring on board members of the Muslim community, or as many of the Muslim community as we can, to the big changes that are happening in our mosques. It's one thing because we have to educate our mosque committees and educate the COVID safety officers. But if we don't educate the rest of the community, then what will happen is that you will have a constant clash. You're going to have complaints, or at the very least, you will have difficulties in how we translate the guidance that's out there. So the idea is that today and on the Wednesday coming, inshallah, we're going to try and make sure that we educate ourselves as to what the new normal will look like for opening masajid at the time of COVID. Jazakallah khair.
Jazakallah khair, Dr. Wajid. So without further ado, I'd like to bring in our first speaker, who is Dr. Munazzah Vora from Bima, who'll be talking in from the medical side of things. Jazakallah khair.
Assalamu alaikum, Jazakallah khair, sister. So I'm Munazzah from the British Islamic Medical Association, and today I just want to briefly go through a few of the questions that you may have before the opening of your local masajid. So without further ado, if we start with the first slide. Firstly, who can pray at the masjid? And by the way, if you do have any other questions as we go along, then please write them in the chat box, and inshallah we'll answer them as we go along. And obviously there's a Q&A session at the end as well. But ideally, if you ask them now, then inshallah they'll be answered quicker. So if we talk about who can pray at the masjid, so whether you're eligible to pray at the masjid at the moment or not, the easiest way to talk about this is to talk about who can't go. So this table is actually taken from the back of the MCB document, and they've released a document which explained the practicalities of reopening the mosques for our community. So at the back of that, the first table is talking about who can't go, and the first 4 rows, just to summarize, talk about people who are high risk, because we know that there are a number of risk factors, things like age and other illnesses, that can make a person more likely to get the severe form of the illness. And on top of that, they're more likely to then spread it to their loved ones and to the community. So we would advise that they don't attend the mosque and pray at home, inshallah. Also, of course, anybody with COVID symptoms shouldn't be coming into the mosque to pray, or shouldn't be going anywhere really. They should be isolating. Anyone who is a frontline member of staff, and that's not because they're more likely to get the illness, but that's because we know that a lot of healthcare workers, a lot of frontline staff may be carrying the illness and not realizing. So the advice is for frontline staff not to come to the mosque, so as to protect the rest of the community members. Also, anybody who is unable to socially distance or follow those rules, for example, young children. So if you don't fall under this any of these categories, then inshallah, you should be okay to attend, as long as you're prepared. So that brings me on to the next slide. Firstly, what should you do? What should you take with you? Some of the things that your local mosque might ask you to bring, firstly, a face cover is pretty much standard. It's very important that you bring one in. And the reason being, as you can see on the right-hand side, the statistics, people who don't wear face coverings are nearly 18% more likely to spread the infection compared to the 3% of those that do wear, as in not 3%, as in 3% is the chance of getting the infection or spreading it if you were to wear a face mask. On top of that, you might be asked to bring a prayer mat. Many of the masajid are asking their congregation to do this. And the reason being because the virus droplets, they can stay on surfaces as well as being spread from person to person in the air. They can actually stay on surfaces for hours to days. And that includes the mosque floor. And if you imagine, obviously, during our prayer, we go down in sujood, and the last thing you want to be doing is putting your face in the carpet where somebody else may have used it before you, and they potentially may have the virus and are unaware. So if you bring your own prayer mat in, if that's what your mosque advises, bring it in. You know how clean it is because it's come from your own home. Once you finish praying, you just fold it again and take it back with you. And that's one of the most, one of the easiest ways for us to ensure that we're practicing some infection control there as well. And thirdly, I've mentioned wudu here. Even government guidelines state that communal washing facilities shouldn't be available at the moment. And that's because really we want to stop people gathering unnecessarily. I mean, we're practicing social distancing, so wherever we can keep distances from people, that's basically why we need to close wudu areas. And also you may notice that toilet facilities won't be available, so it's essential that you do wudu before coming in so that you don't have to be turned away when you do come, and it's not a waste of your time. Thirdly, what you might expect to see when you go there. So when you go to the mosque, some of these I'm sure you've thought about it already. There may be long queues. Of course, we're all excited for our mosque to reopen, so I can imagine there'll be many people waiting to enter again. The queues, the outside and inside, when you're praying, you will notice social distancing in place. At the moment, that's 2 meters. And inshallah, for the foreseeable future, we expect the 2 meters to continue in our mosques. On top of that, you'll notice many volunteers. So your mosque will have safety officers and marshals. It is essential that you comply with their rules, with what the officers are saying to you. I mean, they're going through extensive training at the moment to make sure that they're in the right position to keep the community safe. So what we ask from the community is to just follow the rules, and inshallah, that will benefit all of us. Lastly, let's talk about why your mosque might actually be doing more than what the government requires. So as an example of that, earlier when I talked about high-risk people, the government states high risk as being, or vulnerable people as being those who are 70 years old and over. You might notice that your mosque actually says those who are 60 years and over, or even as low as 55 years, shouldn't be coming to the mosque to pray. That's not a blanket rule. I'm just saying that might be what you notice at your mosque. That is because this table that you can see in front of us is recent data from the Office of National Statistics, as you can see. And at the top of this, what this shows is how many people are dying per religious group in every 100,000 of population. And what that means is Muslims are dying more than any other religious group. And Muslim males, as you can see, which is the blue line, so blue is male, yellow is female, our numbers are staggering. And there are lots of factors that play into this, but the bottom line is that we need to be more careful. We need to be careful for our vulnerable people in our community. We need to be careful just generally for our families, for our individual selves. Things like genetically, we might be more prone. We know that ethnic minorities, people who come from Black and South Asians, they're more likely to be in hospital, in intensive care, and more likely to die. We're talking 3 to 4 times more likely to die than our white neighbors. On top of that, we have many other health issues within our communities that put us more at risk. We also may have things like social or economic factors that put us at risk. But all in all, the leaders in your mosques, the leaders in our community, they have taken all of this into consideration. So even if you notice differences between the mosque and the rules for different communities, it's because your leader has taken their specific community into consideration. They've spoken to legal teams, health and safety officers, medical advice. And that's why they've come to these conclusions. So it's essential that we comply. And that brings me to the end, really. But if you have any questions, like I said, please ask in the chat box, and I'm hanging around till towards the end. But inshallah, the Q&A at the end will be taken by Dr. Wajid. But in the meantime, I'll try and answer as many questions as I can in the chat box. Jazakallah khair. Assalamu alaikum.
Wa alaikum salam. Jazakallah khairan, Sister Munazza. So next up will be legal training. And this is from Sister Ifat Nawaz, who is the head of the MCB's Legal Affairs Committee, and also part of the Muslim Lawyers Action Group. And she'll be talking about the legal aspects that the general community need to be aware of, inshallah, with regards to COVID.
Assalamu alaikum wa rahmatullahi, everyone. Thank you for joining today. Can you hear me okay, firstly?
Loud and clear, Jazakallah.
Yes, Jazakallah. Okay, what I intend to do in a very short period of time is to explain the measures that the mosques, committees and trustees are putting in place and why we should all be supporting that. So if we go on to the next slide, firstly, I'll just run through these very quickly. The legal obligations insofar as the masajids are concerned lies with the trustees and the management committee. They have legal responsibility to ensure that the mosque is a safe place for themselves, their workers, their volunteers, and all the visitors that visit the mosque. And that legal duty exposes the organization and the trustees to personal liability if they don't put in place as many measures as are reasonable to protect everyone. So they will go through a process before they decide to reopen the mosque, which must not be before 4th of July, but it does not have to be 4th of July. Many masjids are delaying opening because they are they're preparing and they're putting the measures in place. So they have to provide training. They are going through extensive training for their staff, their trustees, their volunteers, to ensure that they are complying with the government guidance on the safety measures that are expected from the government for all places of worship. Having done that, they will then decide that they're going to open the masjid. And as Dr. Munazza said before me, they're putting in place measures that will operate when you enter the mosque and when you leave the mosque to ensure that you're protected and that everyone else is protected, so that they've done their utter best and they've discharged their legal obligations as best they can. Because, as you will be aware, no one can totally eliminate the risks, but they have to put in place measures that show that they've done as much as possible. If we can go to the next slide, please. As I said, it is the trustees and the management committee who are responsible for the measures that they set out in the mosque. But there is also legal responsibility upon yourselves, because, as you know, the government guidance has been issued about social distancing and what is expected of all of us. And it's really important to understand, particularly from a Muslim perspective, that organizations to ensure one's safe. I got asked a question at one of these sessions that what happens if we completely ignore the advice and the guidance and open on the 4th of July to everyone? Well, what will happen probably is that someone will report the mosque to the council and to the police, because it becomes a public health risk. And there is then an issue that the mosque will be shut down by the council or by the police because it's exposing everyone to risk. You know, that's not certain, and that hasn't happened yet. And the police are trying not to use their powers, and the councils are trying not to be heavy-handed. Everyone is trying to work together to try and ensure that everyone is safe. But if one of the issues that the masjids are facing is that, you know, when people visit the mosques and they're told of this new way of operating the mosque where you will not be allowed in without a face covering, you have to bring your own salat prayer mat, and you have to carry your shoes with you, and then you must leave immediately after the first prayers, which is what some masjids are adopting while they introduce these new measures. if people don't listen to these measures and they try and get aggressive, you know, the masjid has to protect its staff, and you will be asked to leave the premises, and they will have legal rights to do so because they're trying to protect everyone. So you need to be aware of that you know, they're not acting against you, but in your interest, that everyone works together and helps the masjid fulfill its legal obligations, and you do so as well. And I think it's worth here mentioning that if there are problems in places like masjids, you know, what will happen? Because normally what is happening is that if there are gatherings, and this will probably be regarded as a gathering, is that people are gathering and they shouldn't be. The police procedure is to follow the 4 E's. And what they're doing here is they're engaging, they're explaining to people what they should be doing, they're encouraging people to comply with the guidance, and if all that fails, they're enforcing. So, you know, if people are gathered and they're not following the guidance rule, the police cannot ask people to disperse. The police can also impose fines on people who ignore the instructions, and they can arrest people as well if they think it's proportionate and necessary. And really, these are the kind of scenes you don't want at masjids. You want people to work together. But just as information, you need to know that the fines that the police can impose for people who are not following the government guidance varies from England, Wales and Scotland, but it is quite heavy. And, you know, the initial offences are, fines are around £100 in England and £60 in Wales and Scotland, and they go up for second offences. And, you know, this is a kind of issues that you don't want to be facing, because the whole point about putting these measures in place is to avoid this. And leaving all this aside, the bad publicity that will come if masajids have problems when they're opening with people being aggressive, forcing their way in, or not complying with the requests and the new ways of operating. We can go to the next slide, please. How do you discharge your legal obligations? By listening to the new way of working that the masjid has set out. You will find some masjids are opening on a phased basis, where they are testing the new operation, and they're opening for, say, Zohar and Asr only. And they are asking their members of their congregation to register online to come and pray to the masjid, so they can manage, because when they are having to impose a 1 meter or 2 meter social distancing, obviously the number of worshippers that will be allowed into the mosque now is dramatically reduced. So to manage that, some masjids are asking for people to register online before they enter, so that they don't make a wasted journey. And that's quite important. So when you go in and you follow the guidance that your masjid has set out and asked you to comply with, and work with them. And I'm sure as they are able to manage this, and you discharge your legal obligations, they discharge their legal obligations, it all helps to a better working relationship, inshallah. Next slide. I've just set out some of the powers that the local authority and the police have that will be utilized if people are not complying with the guidance, and if there is trouble at the masjids because people are not listening. And I don't want to bang on about that, because I think this session is not about instilling fear, it's about instilling knowledge and cooperation, and in the spirit of Islam, working together for the better good of the whole community and the public at large. And mashallah, you know, the Muslim community has been exemplary through Ramadan in the way we conducted ourselves, and inshallah this is to build on that. I can see quite a few questions on legal. I'm happy to take them at the end, inshallah.
Is that all, sister? Jazakallah khair. Jazakallah khair, Sister Ifat, for the information, and we'll take the questions at the end. Next, I'd like to introduce Brother Shoaib Mia, who is a health and safety inspector supporting a lot of masajid up north and across the UK, actually, in reopening safely. Jazakallah khair.
Assalamu alaikum. Bismillahir Rahmanir Rahim. Thank you all for attending, and we shall start with the key points that you need to know in health and safety. The first and most important rule in the actual reopening of the masjid is that we keep the masjids open. The way that we do this is to adhere to all the rules set out by the masjid. We all understand the government guidelines. We've had the education for the last 6 months. We've had the education of when we go into the superstores, for when we go out shopping. However, in the masjid, they have their own rules, they have their own guidelines, and we need to adhere to this with the knowledge that we've already gained in the last 6 months during lockdown, and with the understanding we have of the COVID virus. In order to keep the masjids open, we are as individuals responsible. When I say we, I mean those who are attending the masjid to pray the Jummah, pray the Salah. We have to take responsibility as part of the community as well. This will ensure that the masjid committee members and trustee members and the management of the masjid are able to maintain their legal obligation in ensuring that they are compliant with the law and with guidelines provided by the government. We have to take ownership and responsibility over this. I think this is a very critical point, and it's sort of a blanket rule for all masjids. However, I must stress that each individual masjid has their own rules, own site rules, because layouts are different, capacity numbers are different, and the location of the masjid is different. So as well as the understanding we have for the last 6 months, as well as the understanding we have of what COVID is, we need to listen, look, and be educated by the masjids as well. And we need to promote education within the community and, in a way, police our own community and share this information. The next slide is the actual masjid is having an understanding of what the masjid has put in place to keep us safe. What we've looked at is, I think we've skipped a slide. Let's go back one slide, sorry. So the masjid itself has undertaken a risk assessment. The risk assessment includes all the identified problems that could potentially harm us as attendees, and these have been addressed, inshallah, by the masjids, and they've put in place control measures that will keep us safe and keep staff members safe inside the masjid. So not only do we need to look at ourselves when we enter the masjid, but we need to look at how we're keeping those who are working inside the masjid to maintain the door access for the imams as well, for the those collecting donations. We need to keep those individuals safe as well. For this reason, the masjid's been working very hard over the last 3 months up and down the country, trying to put things in place such as COVID officers who will be responsible for each Jummah and Salah. There's cleaning measures. Masjids have put a lot of resources in, a lot of time and effort into these resources to make these masjids safe for us to attend. All this needs to be respected when we enter the masjid and remembered, so that we know that we ourselves are being thought about when we're into the masjid, but we ourselves need to also think about others as well. Next slide is basically the way that the masjid has introduced all the hard work that they've put into place to keep us safe and themselves safe. The first and most obvious one is the posters. When you're walking into your masjids, please look at the posters, please read the posters, and please adhere to the posters. If, as an attendee to the masjid, brothers and sisters, if you're on social media, these messages are put on social media for a specific concern, a specific reason, and that is to keep us safe. All relevant information is to help stop the spread of disease and have virus control. Please, if you do receive any of these messages, share it, educate your own family, educate your own friends, and while at the masjid, brothers and sisters in Islam, we need to obviously make sure that they are adhering to the rules and abiding by the site rules as laid out by the masjid's posters and communication. Quickly onto the next slide. So if you do see something in the masjid, do you think that this poses a potential risk? It can be a harm. It can potentially not promote safe COVID conditions, but promote unsafe COVID conditions, then you should alert a member of staff. You should speak to anybody who you know inside the masjid, or even share this on the social media, or communicate with the masjid if you have the communications channels such as text messaging, WhatsApp groups. These things need to be addressed. We talked about the masjid working very hard over the last 6 months. There's been a lot of assistance, there's been a lot of hard work gone into reopening of the masjids. I promise you, not everything has been thought about. The masjids haven't been fully open yet. When they open, potential new issues, concerns might arise that these hardworking individuals have not come across because they've been busy trying to promote paperwork, documentation, compliance. If you see any of these, then make sure you alert and you bring to the attention anything or any changes that you feel might be important. That being said, the next slide is, I'll pass it on back to the host. Thank you, Jazakallah. I'll answer any questions. Jazakallah.
Jazakallah khair, Brother Shoaib. Any questions, just to remind you all just to put it into the chat, and we have a Q&A session at the end. Next up, I'd like to introduce Brother Adil Chowdhury from LaunchGood, and he'll be talking about how you can support your mosque with fundraising. Jazakallah khair.
Jazakallah khair, and thank you to all of the previous speakers and everyone involved in hosting and organising these sessions. So, as the sister said, my name is Brother Adil, and I work with LaunchGood, which is a Muslim crowdfunding platform aimed to uplift communities and community projects around the world. And I'm just here to share 3 pieces of advice that you can take on board and really support your local masjid with. So if we move over to the next slide, the first piece of advice is to find your mosque online. And LaunchGood, in partnership with the MCB, has launched a very innovative Support Our Mosques program, where any masjid in the country can sign up, and their online fundraising pages made for them, and then they have access to coaching, training, and a whole host of resources in order to kickstart their online fundraising presence. Because as we know, coronavirus has really hampered the fundraising efforts of many masajid, and the ones that are hit hardest are the smaller local mosques that really relied on the cash that they get in donations, you know, every Jummah or every week or every month, especially during Ramadan. So it's so important that we find more avenues where we can support our mosque beyond just, you know, giving a few pounds when we do go, when we are able to visit. So one of the best ways is to support them online. Everybody has a phone and it's at the tips of your fingers. We have over 150 masjids that are registered already. So if you go to launchgood.com/support our mosques, you can scroll down or search for your masjid and find them that way. However, more importantly, if you can't find your masjid on the Support Our Mosques page, please do speak to the committee and ask them to register. All they have to do is go on to supportourmosques.com, fill in their details, and we do the rest in terms of getting things set up. And then we work with the masjid committee to make sure everything's approved and they're ready to start fundraising. So the first piece of advice is find your mosque on launchgood.com/support our mosques, or ask them to register with us so we can help them build an online fundraising presence. The second piece of advice on the next slide is to help promote that fundraising page. Now, it's all good having a fundraiser online, but if that doesn't reach people, then its success is inevitably going to be hampered. So really consider promoting it. Consider also that any money that you give, you know, in cash or, you know, in when you're in the masjid, consider paying that digitally, just to avoid any, you know, contaminated coins or cash being shared. You know, consider making that same Jumu'ah donation that you used to give every Friday, consider doing that online, where things are a lot safer and there's less risk involved. Also consider making your online donations to your masjid part of your weekly giving routine. So set a reminder on your phone that every Friday, whether you go to Jummah in the masjid or you're not able to, make it part of your culture that you're going to give, £5, £10, £20 every week to that masjid, and encourage your friends and family to do that too. But as I said before, unless people see this fundraising page, they're not going to be able to donate to it. So please, 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 champion your masjid and share their fundraising link with your friends and family regularly. And for every pound that they donate, inshallah, you'll be rewarded as well. So for the masajid that do have a page, please donate on it and promote it on a weekly basis, inshallah. And the final piece of advice is a new scheme that has been launched by Support Our Mosques, with the support and sponsorship of charities such as Penny Appeal and Mercy Mission, is something called Jummah Grants. Now, in previous webinars with masjid committees, we've gone into a lot more detail, but essentially what this means is that every Friday from next week, inshallah, for the foreseeable future, masjids that are taking part in this scheme will be able to win a grant of up to £1,000 every single week. So between £1,000 to £250. All they need to do is have a fundraising page registered on the site and attract the most number of donors. And so if they are competing, all you need to do is to donate and get as many friends and families to donate on the same day, which will be the Friday. And inshallah, if your masjid does win a grant, then your donation, whether it was £1, £10, £20, will mean so much more. And inshallah, this is a means for us to continue supporting our masajid with grants or with much needed funds, primarily for smaller mosques. And another thing you can do is if you visit launchgood.com/support our mosques, there is a page there where if you do have extra funds that you'd like to distribute, but you don't know how to give it to so many mosques, there's a campaign there where you can donate to that one campaign, and then the funds raised there is added to the pool, which is shared across the masjids through the grants system. So please, if you know someone involved with the masjid, a volunteer or a committee member, speak to them and ask them, have you heard about Jummah grants? Have you heard about this Support Our Mosques thing? And, kickstart that conversation, because, many masajid committee members have joined these calls, but I'm sure there are many others that haven't, or they may have joined but have missed, certain bits and pieces. So please, reinvigorate those conversations around having an online presence, really pushing their fundraising page online, because many people, especially if your masjid is, practicing social distancing, how it's been advised on this call, much less people will be able to attend the mosque on a Friday. But if the masjid and if volunteers and if the congregation have a solid plan to share that link or that fundraising page, then you'll be able to access not just the regular congregation that you would have got had COVID not been an issue, but also far more people, beyond even your locality. So please, please, please consider these 3 pieces of advice when thinking about fundraising and the financial sustainability of your masjid. So that's everything from myself. If you do have any questions, you can email me at adel@launchgood.com. I'll post my email in the chat box. Otherwise, I'll pass it back over to our host. So Jazakumullahu khairan. Assalamu alaikum wa rahmatullahi wa barakatuh.
Jazakallah khair, Brother Adil. Really informative, and inshallah everyone in this group will be able to support our masajid. Next, I'd like to bring in Dr. Wajid Akhtar, who will be going over our logistics training. Jazakallah khair.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khairan, everyone. So this is the last part, and I like to summarize what we've learned so far so that it just teases up for a nice conclusion, inshallah. So this training is primarily focused at the general Muslim public, not at the mosque committee, not at the COVID safety officers, not at the experts, at your average person on the street. How is the mosque going to function in the new normal? And this is incredibly important that we get this information out. Everyone in this call is someone who's highly motivated. That's why you're here on a Sunday morning. but the majority of our community might not be aware of this information, or they may have parts of it, or they may be even misinformation out there. So this is important. How important is it? This is a life or death issue. Make no mistake, the second wave is absolutely, nauzubillah, but it is coming. Unless there is a vaccine, you will have a second wave, and then a third wave, and a fourth wave. And it's the second wave that is the most dangerous. We don't know when it's coming, but we know it is most likely coming. And when it comes, it's up to everyone to save themselves and their family, and then their community first. So I can't educate you on what you do with your workplace or in the shops or whatever. I mean, we will try to get this information out as the British Islamic Medical Association, but the mosques is a particular issue because this is an area where you have the elderly and the young, where people gather. The way we pray, the length of time that we're together, this is much different to going to a shop. This is different even to a workplace and so on. So this is life and death issues for people. Definitely it is. We have seen that there are waves that are spreading in other countries. We want to avoid it. So key issues, what you need to know. If I summarize, what you need to know from the medical side is who should not come to the mosque. Educate people in your community. Pick up the phone, write a quick message on WhatsApp. If it comes from you, people will listen because they know you. If it comes from us, they don't know us. So educate who should and should not go to the mosque. And yes, you have to have uncomfortable conversations. We were in a webinar call with the Americans, the Canadians, and Australians last night on this issue. And they said that the mosque imam, because he falls in the high-risk category, he went to the mosque and he stood outside away from the door, telling everyone, even I am not going into my own mosque to lead the prayer because I'm high-risk category. To show people that he's applying the rule to himself. So educate the people who should and should not go to the mosque. From the legal side, we need to be aware that there is a legal ramification for this. If things are not done properly, this is not something that can just be ignored and it has no consequences. There are medical consequences and there are legal consequences. And there are questions about that we need to answer. From the health and safety side, there are issues that we have to see. What is the mosque doing to protect us? What can we do to help the mosque protect us? And from the fundraising side, the mosques are struggling financially. The economic impact is huge for the businesses and for our masajid. Make sure that you help them go digital. If you have the skill, or your children or your nephews or your nieces, someone has the skill on how to go digital, inshallah. Help them, support them. Brother Ayub was sharing a good guide that he's got, it's in the chat box, on how to go digital, and go to supportourmosque.com, inshallah. So that is a summary of where we are right now. So before you go to enter the mosque, few things that you need to know. Please turn up with the right equipment. If you don't come with a prayer mat, go home. You don't argue. You cannot take the risk just for yourself. You'll be taking it for other people. Come with a mask. The mask reduces your risk of infecting others and vice versa. Come with the intention that you have done wudu and that you're going to socially distance. And be prepared to be turned away because the capacity is reached. Don't create a scene. If they say, I'm sorry, but there's no more space for you, don't stamp and huff. And if you see other people doing it, explain to them gently as well why it's important that that we adhere to the capacity rules. What do you need to know inside the mosque? Inside the mosque, the information is there. The 9-step guideline is on the MCB website. You can check it out. But it's the same things. Mask, avoid touching things, bring your own carpet, stay for the prayer, and go and pray sunnah at home. And this is no excuse now, this time, to pray your sunnah, 5-10 sunnahs in the mosque, because it increases the time that you're there, which increases the time likelihood of catching infections or passing it on. And when leaving the mosque, don't have a congregation, don't have a crowd. Go quickly and in a very British queue-like fashion, leave. So the special point that I want to finish with on the logistical issue, brothers and sisters, is that this is a difficult and a unique situation. And we have two ways that we can approach this as the Muslim community. We can either approach this as finding faults with the mosques, being angry at the mosques, pressurizing the mosques. Almost every mosque we spoke to has told us they feel pressurized by the community. This should not be happening. The mosque committee, because they're legally liable, should not turn around and say that. They should say, I feel supported by my community. They should say, I feel safe with my community. My community is telling me, you take the decisions, we will back you up, because you are in that position and because you have looked at all the information. And we will support you if you need help. Don't pressurize your mosques. Don't complain. I mean, if there's something wrong, then rectify it. I'm not saying they put up with any nonsense, but don't pressurize them to go too fast. Each one of us, we make our own decisions. Somebody will say that I don't want to wear a mask. Other people will say I want to wear a mask and gloves. But what we shouldn't do is impose our decision on other people. And if you are the one who's taking risks, you're not just taking it for yourself, you're taking it for everyone. Remember that point. The elderly uncle who says, I don't care, I'm 80, I have all these diseases, and I have a cough, and I'm coming to the mosque because I don't care if I die. Well, that's your decision, but it's not fair that you're taking the decision for your wife. It's not fair that you're taking the decision for your children. It's not fair you're taking the decision for the rest of the community. We're all in this together, inshallah, and we will succeed in this together as long as we remain united together, inshallah, upon our Islamic values, upon our deen, and as a community. Wa jazakallah khair.
Jazakallah khair, Dr. Wajid. It's a good reminder for us all to stay in line with the rules, inshallah, to protect our families. Moving on then to the Q&A session. There are lots of questions coming up onto the chat. So I'm going to go in order. One of the questions is, why is the school guidance and the mosque guidance for children under 10 years of age different in respect to attendance? I'm not sure who's best to answer that. Sister Ifat? Or
I can just touch on this. Essentially, the guidance for places of worship, which is what we're focusing on, is that children under the age of 10 shouldn't be allowed to come into the masjid. Essentially, because parents find it difficult to set down and control the children not to go to certain areas, and they're exposing themselves and others to risks. And that's just the guidance that the government has given. The guidance in the schools is different, it is much more stricter, and there's a lot more staff to follow that guidance too, whereas in the masjid it's a different scenario, and it's really quite it's up to each masjid about how they operate with the children. I'm sorry I can't be more helpful than that in this regard.
Jazakallah khair. Next question was around the age limit of 60 versus 70. I think it's important to discuss this because there is a difference. Dr. Wajid, did you want to come in with this one?
Sure, Jazakallah. So the official one set in the country is 70. It is the highest in the world. Most other countries are 60 to 65. So that what the government sets is the limit. You don't have to go by 70. You can say 65, and we are a higher risk community. So it's easy. If you said 65 or 60, you will be well within your rights. The difficulty you will find is that if you said 65, but the government said 70, then you will have to be prepared that people will challenge you in your community and say, I'm 67, I'm legally allowed to come, or I'm legally not classified as the highest risk category. So this is why our guidance has stuck to 70, but if you can try to educate your community at a lower level, that's better.
Jazakallah khair. Next question is around the 2 meter versus 1 meter rule. There is a change, but it's important to note that change is only in England at the moment. I don't know who would like to come in for this one. Dr. Munazza, would you like to come in?
I think Sister Minaza had to leave.
Okay, apologies. Dr. Wajid, do you want to come in then?
Yeah, very simply, again, it's the same thing. The 1 meter rule has been brought in for economic reasons, not for health reasons. At 1 meter, the mosque will be able to have 50% capacity. At 2 meters, it will have less than 25% capacity. So it's very tempting to go to 1 meter. But the other side of the coin is that at 1 meter, your risk is at least double. Some people or some studies say 10 times more. So we ask that the mosques consider it. You know, if you are okay to go to 1 meter legally in England, as Sister Ala said, only in England, but the risk is double or more for the community.
Jazakallah khair. Next question, how would MCB consider the Jummah effect? Sister Ifat, or?
Sorry, can you just, what's the question?
How would MCB consider the Jummah effect? I'm assuming around numbers, so the numbers can be very difficult to manage, suggest adopting an online booking system for Jummah. And a question on GDPR as well, how do we legally protect and ensure the safe data?
I think the same, what we're advocating, inshallah, is that the same rules apply. A number of masjids that we're aware of are not running the Jummah sessions still. You know, many masjids are not opening on the 4th of July because they're putting these measures in place. And many are not running Jummahs at all because they're saying they want to see how their congregation responds to the measures that they're putting in place. And I think trying to carry out a Jummah straight away may be difficult for a number of masjids because they don't know how their congregation is going to respond. But the same measures should be put in place about educating the community, setting the measures in place, communicating so that the community knows how the masjid is going to run on a Jummah, if you're going to run a Jummah prayer, explain the limit in numbers, explain how people can make sure that they have a place when they come to pray, and then implement and monitor the attendance to make sure that you comply with the requirements. It is going to be a lot of work for the masjid, the staff and the volunteers to do that, and the community should help them in respecting the rules and guidance that's being laid down, inshallah.
Jazakallah khair. So many questions, mashallah. So this one, as COVID pandemic has evolved, we have discovered a digital deficit in some socially disadvantaged areas who have poor understanding and availability of digital platforms. What alternative cost-effective measures to support these localities? I'm not sure who's best to bring this one in. Dr. Wajid, would you know anything?
Maybe Brother Shoaib?
If it's around the communication, a few of the masjids already have decided that the communities are of an older generation and Facebook and social media are not particularly at the forefront of their communication and understandings as well. So what they've put in place is leaflets and also having a little meeting before the actual opening of the masjid to invite community members into the masjid to explain the rules, explain the opening, get the community involved. I think if you have been given this opportunity, you should do that. Even consult with your masjid what the opening rules are and what the actual guidelines have put in place for the masjids to open. Jazakallah.
Jazakallah khair. I'm also aware there are funding opportunities out there to support local communities for digitally deprived areas. So I would look into your local authorities for any funding that's available as well, just to add in on that one. How do we deal with cash donation sanitization? I think this is covered in the logistics of Dr. Wajid.
Technically, I believe that the latest guidelines saying that you shouldn't take cash donations. I'm waiting to get that clarified. But Adil did a bit on this in the previous webinar. Adil, do you mind taking that?
Yeah, that's absolutely fine. So some pieces of advice that we've given to masajid is to firstly explore contactless options. So I know you can get roaming touch sort of boxes where if you tap your credit card or your debit card, a donation will be taken. Some masjids have been very proactive and they're using this. However, if you do take physical donations, instead of having it roaming across the safs or the lines, maybe keeping just one box by the entrance so people can walk past and drop their money into that. That avoids any sort of close contact with a volunteer that, you know, carries the cloth or the bucket. However, if masajid do stick to the sort of traditional method of, you know, a gentleman walking around with a bucket or a cloth to collect monies, masajid should ensure that they have adequate PPE, and also you can sanitize the coins or the notes taken, spray it with disinfectant. And we also advise that the committee members or the volunteers who are involved in counting the money should wait at least 72 hours before doing so. Instead of counting it straight away, you should wait a few days. So if there are any, you know, remaining, you know, remnants of the virus, that would be sort of dissipated by, you know, 72 hours. And so that waiting period is just an added precaution. So if mosques are doing traditional on-site fundraising, these are sort of the pieces of advice and suggestions that, you know, we share with them.
Jazakallah khair. The next question, how do we comply with the Equality Act and to ensure we do not discriminate those with disabilities? As patrons' information is limited due to the open door access before COVID-19, it is hard to undertake risk assessments and know those who would meet the criteria for attendance based on government COVID secure guidance. How do we ensure we do not discriminate? I'm going to invite Brother Shraib with this one, please.
Jazakallah. The actual masjid itself, we need to look at in that sense. Do they already have in place the facilities for wheelchair access, for disability, hard of hearing, other disabilities? What provisions have they got in place already? If the masjid, for COVID reasons, is looking at social distancing, prayer times where they have a certain allocation for capacity, then perhaps in order to ensure that the masjid is being compliant with equality, it might be worth having sections of the masjid, if possible and if feasible, that allow wheelchair access. I know some of the older generations require seating and seated areas rather than just prayer mats. Those sections are part of the Equality Act as well. So it's just basically accommodating. Ultimately, with the masjids, we have to be realistic. Same goes with the donation collecting, same goes with allowing under 10s to enter the masjid. We have to be realistic with what is actually our community about. If we have a lot of wheelchair users in the community, then we have to make the provisions for that. If we have a lot of reasons for allowing those under 10 years old because the parents bring the children with them but they're not being compliant, we have to be realistic in a sense that, are we actually providing the facilities to allow the under 10s to enter the masjid and be safe? It's all about being realistic. Jazakallah.
Jazakallah khair. Can we hire out other masjid facilities, such as a hall for weddings? Sister Ifat, would you be able to answer this?
Yeah, the guidance that was issued recently about being able to have weddings for up to 30 people applies to masjids, and I think that applies overall to the masjid. So I would not advocate holding more than one wedding, you know, at any particular time. The limit is 30 people. Ensuring adherence to that is going to be difficult. So yes, they will be able to hold weddings in the masjid, but there is a limit on numbers. And that's, we have sought further clarification from the government on that, but at the moment that's the position as we understand it.
Jazakallah khair. Just to add on to that, is the 30 number limit for a masjid as a whole for prayers? Is that including in prayers?
Yeah, we don't think the number 30 limit applies to prayers. You know, so if the masjid can accommodate in in observing those 2 meter, 1 meter rule, more than 30 people, then it should be able to do so. The 30 people limit, we believe, applies only to weddings.
Jazakallah khair. Next question. What advice or would you suggest for repeat offenders who won't follow the mosque guidance? For example, 80-year-old uncle with multiple comorbidities refusing to go back home. Dr. Wajid, could you come in with that one, please?
Jazakallah khairan. At the end of the day, there's two parts to this. One, are you going to be able to tell someone's age just by looking at them? Are you able to tell someone's risk status without having an invasive question where you have to sit down and tell me whether you have diabetes? Wait a minute, you have a palpitations, does this count, does this not count? Remember, that's not realistic. Realistically, you have to, to get the high-risk people to stop coming to the mosque, to get people stop coming to the mosque who are coughing. We get this all the time as GPs on the phone. And then they say, oh, don't worry, doctor, it's not COVID. How do you know it's not COVID? I know my body. This is a lot of people. I know my body. Oh, yeah, it's hay fever. They make every excuse. It can't be COVID. And you say, look, it can be. You have to isolate. So how will you know these people? Realistically, you won't. So you have to educate your community. So you are the members of the community. Please educate the others who did not come here today. And please share the message in your groups, in your WhatsApp groups, in your e-group or whatever you have for your community, and help the mosque get this information out. And there's a lot of good resources on the MCB website on this. Number two, if there is someone that you know is high risk and you are telling them not to come in and they're still wanting to come in, it's unfortunately, it's not their decision. They cannot take this risk on behalf, and their legal liabilities on the trustee. They cannot take this risk for the person who is next to them praying, who doesn't want to take that risk, and they cannot take that risk on behalf of their family. So if someone does come, you have to be polite but firm. I'm sorry, you cannot come inside. These are the rules. We really apologize. We understand, and we are going to support you. It's not like you have nothing to do with the mosque because you can't come here. We're going to continue our online activities. We're going to live stream our khutbah. We're here to support you 100%, but we want to protect you and everyone else. You cannot come inside. You have every right to say that, and the rest of us will support you. Inshallah.
Jazakallah khair. I'm just going to go for the last two questions. What's the guidelines on tracking? How is this being done? Sister Ifat, would you be able to come in on this one?
I'm sorry, but this one I'm not able to assist on. I don't know if any of the other speakers can on the tracking.
Brother Shoaib?
The tracking, what was the question, sorry?
What's the guideline on tracking and how is it being done?
So tracking is basically a way to obviously find out where the virus has been spread and if we have come into contact. To make this practical for the masjids, what we've done is we've tried to bring together the registration of those entering the masjid to see which congregation they were a part of. If this isn't possible because you're not taking registration, I know some masjids are not. Some masjids are just basically counting the numbers on the door. So if the capacity is for 50, they're stopping the numbers coming in after the 50 have entered the masjid. So in that case, either provide a number to the community, to get back to the masjid to say that yes, we have signs, and they can then alert the masjid of which congregation they were a part of and where they were potentially sat in the masjid. And then from that, the masjid can put onto the Facebook or the social media, if you're a part of this congregation at this time on this date, we potentially have signs of somebody with COVID symptoms. Please get in touch with us for further information, or self-isolate, or get a self-test carried out.
Jazakallah khair. We have a question here regarding its future planning for Eid al-Adha and Jum'ah. If they were both to happen on the same day, how do we manage the risks associated with that? So how do we tackle that situation? Dr. Wajid, would you be able to come in with that?
Sure, Jazakallah khairan. I'll answer that, and there's a few small questions on the side. If I'll just bundle that up because I know we've gone over time. There will be guidance coming out about Eid al-Adha and a little bit more about Jummah in a bit, but we're just working towards the opening of the mosques first. But there will be guidance coming on about that, inshallah. So don't worry, we have a bit of time to prepare for that. Number two, anyone who's missed part of this webinar, it is recorded, so it will be available for those who would want to catch up, and maybe share it with your family, especially if there's particular sections or particular areas that you know, or your community that you know that they need to hear about those issues. Number three, we're not going to completely eliminate risk. We're just going to reduce it by taking reasonable measures. So we want you all to support your mosques by helping them with these measures. The mosques are scared. What the mosques are scared about is the backlash from the community. Why are you not letting me come to the prayer? Why can't we do this? Why are you stopping me from entering? I have a cough, but I always have a cough. That's what they're worried about. They're worried about the pressure from the community on one side and the pressure from local government, police, or public health on the other side. So let's remove the pressure from our side, inshallah, and work together with our mosques, because our mosques are part of us and we're part of the mosques, to work with them, inshallah, to help with that, taking that pressure off. And wherever you see an issue, wherever you see like, oh, our mosque did not speak to the local authority, or they haven't sent their plans to the police, offer your help. Help them to do it. Because there's just people like us, they're busy, they all have their own jobs, their own family, their own time as well. So offer to help them with saying, let me connect you to the local police, let me connect you to the local authority. Oh, I will go and speak to the neighbors about if the queue starts outside the mosque and it's too long, I will volunteer to do X, or I'll volunteer my kids. And this is a really good opportunity. Get the youth involved. The youth are lower risk, and this is a really good chance. Get the youth involved in the masajid by making them part of the COVID safety team. Tell them, look, you're young, you're teenagers, I want you guys to help the mosque. I want you to help with the digital side. I want you to help with the fundraising. I want you to help with the track and tracing. I want you to help with this, that, and the other. And they will not only be attached to their mosque on a spiritual level, but on a practical level as well.
Jazakallah khair. And with that, I think we can conclude today's session. As Brother Wajid said, this is recorded, so it will be available. Please share it out. Jazakallah khair, everyone, for joining. If you have any more questions, please email it through to covid@mcb.org.uk, and we can try and support and help wherever we can. Jazakallah khair. Assalamu alaikum wa rahmatullah.